So
That Venn
yeah,
diagram that you have, the contagion circle, I'm sorry, I just jumped in, Dan. Did
no,
you?
no.
So it's basically a Venn diagram that you use to develop a very complex topic, but in a very simple way for people to understand. But being a professor as you are, I know you have other frameworks to offer in terms of training or telling people or explaining to people about cruise line public health. You refer to 5 pillars of public health. Now would be a good time to chat about that. Can you explain them to us?
Yes, anyone who studies public health, even at the bachelor's level, but definitely in the master's and doctoral systems, you're going to learn about the 5 pillars of public health, and you're going to study each of those. And that includes biostatistics, of course, which is very useful in epidemiology. It's used in epidemiology, the second pillar, to test out theories to see what's most likely or what's the most risky of something. So you've got biostatistics, epidemiology, environmental health, which is what the Vessel Sanitation Program is all about. It's people that are schooled and experienced in environmental health science, looking at food and water and recreational water and child care facilities and all these different environmental factors, housekeeping, to try to assess how they're doing as far as cleaning and following the recommendations that CDC has. And then, so those are 3: biostats, epi, and environmental health. And then public health training, a very critically important part of any public health program, and then public health management. And when you think of these 5 sort of pillars of public health, every one of those has been critically important to the Vessel Sanitation Program and to public health on board ships. And for example, in the old days, when I first started working with ships in the Vessel Sanitation Program, our main concern was doing environmental health inspections. And of course, when we had outbreaks, we would use epidemiologists from the Centers for Disease Control who used biostatistics to try to sort out what was going on, along with the environmental health aspect, and try to figure out what was going on in the ship. But we didn't do a lot of public health training except for what we did on board. But as the program grew and evolved, public health training became a very important aspect. And I believe that the reduction in bacterial diseases that's occurred over time is not in any small part the responsibility of better training and getting people on board the ships trained to understand not just what you should do, but why you should do it.
Right. You know, it occurred to me yesterday that we take it for granted that training, education is available all around us. But the fact is, worldwide education is not available to a lot of people. And in fact, where the cruise lines recruit workers, training, education might not be available. Assuming that to be a premise, where would cruise lines start in terms of educating new hires into the industry, given these pandemic times?
Well, I think a number of cruise lines actually have training facilities for new crew members in their countries. I know a couple of companies that do basic training before the people ever get on the ships. And that includes some public health training as well. But I think that it's interesting from an historical perspective. You know, when I first started inspecting ships in 1980, people, and I'm talking about officers and crew had very little knowledge about public health and especially about why certain things were required. They didn't understand the mechanisms that go into disease spread and so on. And, you know, once the program started to do training, and it's not just the VSP, although VSP they've been doing several trainings every year, and typically it's for management in the cruise ship industry. And Catherine, you've been a very big part of that, and you know, you should be. I'm very just glad that you were there doing it, because
With
it's
Dr. Dumedy, Dr.
and
Don
Dr.
Dumedy. Yeah,
Dermody,
he
and
did it.
it's for so many years. But that's not the only training that's going on. Also, consultants are coming on the ships, and every time we come on, we do a series of training sessions for new crew, but also for crew that have been there. And the training evolves as the science for public health evolves. Also, the ships have their own ongoing public health training. So public health training has been really a huge part of the evolution of the cruise ship industry. And I have to say that, you know, in the old days, and I keep referring to that, but I'm talking about the late 70s and definitely the early 80s up through the mid 80s, most of the diseases that were happening on the ship were bacterial diseases, and usually those were caused by food or water. And if you look now at what's happening on the ship, the majority, and I would say back then, about 85 to 90% of the outbreaks were caused by bacterial agents that could be identified on the ships in stools or vomitus or whatever, or maybe even on objects, or in food. But that whole scenario has completely turned around, and now viral,
Right.
and specifically norovirus, result in about 85% of the outbreaks, and bacterial outbreaks have shrunk to down around 10 to 15%. And in the old days, viruses were, we didn't really have the technology to identify specific viruses. So if we couldn't find the agent, the bacterial agent, then we usually would say probable virus or viral. And that's gone from 10% to 85%. The bacteria, of course, so it's reversed. And a lot of that is due to good training, definitely better refrigeration, better technology when it comes to water systems, recreational water systems, and so on. All that's improved, but the education, I think, is a huge part of that.
Let me catch you before we leave the topic of education. What's your take on educating passengers?
I think that that's very important, especially on the basics. You can probably couldn't give them a 3-hour seminar, but you could give them 5 minutes, and even handouts, or a lot of time everyone has TVs in their room, brief little messages. I see them a lot, and the ships are doing that just to remind people to wash their hands. And when it comes to COVID, just as important, if not more important, to wash your hands frequently. And so all those little public health tips and information, very good.